Hello, I'm Kosse and I would like to give you a brief overview of our study protocol entitled mHealth Intervention to Support Asthma Self-Management in Adolescents, the ADAPT study. ADAPT is an abbreviation for Adolescent Adherence Patient Tool. The aim of the ADAPT study is to develop a mobile health intervention to support self-management and to evaluate the effectiveness in improving medication adherence and asthma control of such a mHealth intervention. Adolescent asthma patients show low adherence rates, varying between 30 and 70%, so they do often not take their medication as prescribed. These low adherence rates result in uncontrolled asthma and thereby unnecessary hospitalizations associated with absence of school and work and decreased quality of life. To assess the specific needs and preferences of adolescents with asthma, we conducted a focus group study. The participants of this study recommended a smartphone application as an intervention to support self-management. So we developed the ADAPT intervention. The ADAPT intervention consists of a smartphone application for patients, which is connected to a desktop application for healthcare providers, in this study the community pharmacist. The intervention is interactive, so data and questions from the patient can be sent to the pharmacist, whereas information and advice from the pharmacist can be sent to the patient. The app contains different features to stimulate self-management and improve adherence. First of all, a questionnaire to rate asthma symptoms and monitor these over time. We use the Kosse questionnaire. Second, a medication reminder. With this feature, patients can send an alarm to prevent forgetting to take their medication. Then we have short movies with information about asthma and medication use. The aim of this feature is to educate patients. Next is the chat function with peers. All patients participating in the ADAPT study can send messages to each other. Last is the chat function with the pharmacist. The ADAPT intervention is tested in a cluster randomized controlled trial in community pharmacies. The participating pharmacies are randomly divided over intervention and a control group. Adolescents with asthma are invited, and after we receive the informed consent, the first online questionnaire is sent by email. This questionnaire contains questions on adherence, asthma control, illness perception, medication beliefs, and asthma-related quality of life. After the first questionnaire, the intervention group has 6 months access to the intervention and the control group receives usual care. At the end of follow-up, both groups fill in the last online questionnaire. The ADAPT study aims to include 352 adolescents with asthma. The primary study outcome is medication adherence, measured by patients' self-report and medication refill records. So, with the ADAPT study, we will provide insights into the effectiveness of a mobile health intervention to support asthma self-management in adolescents. To conclude, in our article you will find the rationale and design of the ADAPT study.